Hey everybody, this is Kevin with Nursing KAMP.com, and this is my Fishbone course on the labs you should know. It's an application course which I really cover all the labs that you should know for NCLEX practice, nursing school, and otherwise. I mean, I cover everything from magnesium, calcium, potassium, and even more extent things like coagulation factors, ABGS. I really break down things in application, what you need to know, how you need to interpret this, and how to memorize the lab values. It's all available on nursingkamp.com for my exclusive members, as well as the application of the book that you get when you become a member. So let's go through what's in the course and what you can get from it. All right, well, what are fishbones? Well, fishbones are these things at the bottom, where I really cover everything that covers in these, because a lot of times when we see these things, we're like, well, what are they? How are they? Are we just writing a list and I need to memorize where they are? Well, I show you exactly why we need to know this. All right, so first things, BMP. So we're going to cover the BMP, we're going to cover the CBC, a renal diagram, liver diagram, coagulation factors, cardiac enzymes, and arterial blood gases. This is covered in my book that's available on nursingkamp.com when you become a member. Even the lowest member of silver members still receive this book, where it really has all these different lab values and how I look at these when I'm using these in practice. When I cover my resources and I start to create these resources, I really think about, okay, well, what do we need to know? Not the fluff, not the other stuff. What do I really need to know about this lab? And what do I need to know about this content? So one of my general approach on these resources is always based on that factor. So let's get into the first fishbone. And what we're looking at is the BMP. In this fishbone, what you'll learn is you're going to learn these different areas: sodium, potassium, chloride, CO2, BUN and creatinine, which I call the renal, and then glucose, endocrine. We're going to cover how to memorize these numbers, these lab values, and then we're going to talk about what's a Q. What do you need to know? Is it high or low? What's some meds that are related to it? What are some procedures related to it? And basically how we look at this. That's the biggest thing about it. A lot of times when people are looking at labs, they're just writing down, what those lab values are. This method allows you to really apply your practice and really advance your practice to the next level. The next thing we're going to talk about is called the CBC. Now, the CBC is called a complete blood count, and it makes sense because it's all about blood. And what in this diagram we'll cover how to memorize the numbers. We're going to cover a WBC, the differential, which I call the ladder, which are like eosinophils, neutrophils, basophils, the H and H here, which is your blood, and then your platelets over there. We're going to cover why this is important, how meds relate to it, and how do you use this in practice. The next one we're going to cover is called the renal diagram. And that renal diagram will be broken down again. How do you memorize these numbers? Because a lot of times these numbers are all over the place. So what I do is I kind of basically say, what do you need to know? When do you need to call the doctor? And what is the general gist of these labs? And then we further on break it down. So we'll talk about calcium in this one, magnesium, and phosphorus. And these are all renal related. So generally on renal patients, you have those labs. The next one we're going to talk about is liver enzymes and pancreas, right? So liver enzymes are very important because of liver toxicity and also pancreatitis. And we'll talk about the chronic things like albumin, ammonia, and bilirubin, and what's most important, especially for the NCLEX and in practice. And how would you apply this if you were looking at this content? Now, I also cover pancreas, and I also cover liver toxic medications. Those are highly testable. We need to know those things, and we also need to know those in practice because we don't want to affect their liver enzymes and also their renal enzymes. When we're looking at the BMP over here and we're looking at the BUN and creatinine, we'll cover that too when we cover this course. The next fishbone that we're going to talk about is called the coagulation fishbone. In this coagulation fishbone, I'm going to cover the PT, the PTT, the INR. I'm going to cover the labs associated with it, how to memorize these labs, also the medications related to it, like Coumadin, heparin drip. Then we're going to go on and we're going to cover the cardiac enzymes and also the chronic things like the fasting lipid profile, like how do those numbers factor into our assessments, and what do we need to know. I'm also going to cover the troponins, enzymes, and also the BNP, which is for CHF patients. And we're going to cover that and how that factors into what we need to know. And the last thing we're going to cover is you're going to master ABGs. ABGs, a lot of times, there's so many different methods about it. There's the Rome, there's the tic-tac-toe method. This method right here, you will master ABGs in a way that you will have no problem interpreting, but not only just interpreting, recognizing what's most important. We'll talk about intubation factors. We're going to talk about PaO2, SvO2. We'll talk about add a little bit more to this. Let's push this to a higher level so that you really, really understand why you're doing what you're doing and not just memorizing the labs or memorizing the interpretation. Nursing is not about memorization. It's about application. And in this course, it's all about application. So why do I do this? Well, the main reason I do this is for this. And this is conceptual. So if we were talking about a septic patient, I would talk about how does these labs relate to the septic patient? And that's application. In conceptual camp, we really look at this stuff. And I start to walk through all these sheets in my lectures. And when we really start to say, okay, listen, it's not just a thing about memorization. It's a thing about application. And once you understand the labs are all about application, whether it's peeing, puking, or pooping, or it's drains or anything like that, then you really will master your labs and master your practice and become that nurse. And that's the ultimate goal. You want to be that nurse. Let's do this. Follow me on Instagram, social media, Facebook, on Pinterest. And if you're not a member of Nursing Camp, I welcome you along. Become a Patreon member, and we'll see you soon.